Some people may join in as we go, but welcome and good evening, sisters, brothers, friends. I'm glad to have you join our evening event. I'm Kevin Rebeck. I'm the president for the Manitoba Federation of Labor, and I want to welcome you to our first webinar. So a thank you to the team back at the office who've been working hard behind the scenes to get this set up, and Mike getting it all set up initially, and Darlene managing all the RSVPs, and now Andrew's kind of behind the scenes working the logistics as we go through this. So we're learning some new technologies. I think we've all been evolving and adapting in different ways. I was telling folks that everyone's on mute, and we'll be keeping folks on mute, but we have a Q&A button at the bottom. If you have questions, feel free to type them in there. And some of them we may address as the presentation goes. Some of them may make more sense to wait towards the end, and we'll tackle them then. So we'll make sure we'll get those as we go. Our topic for the evening, of course, has garnered a lot of interest and uptake, and we hope you'll find it helpful. Work, mental health, and resilience during a pandemic. We're all adapting to so many changes right now, and our personal interactions and networks have shrunk. This takes a toll on our well-being and requires us to do things differently. As the Manitoba Federation of Labor, we'll continue to stand up for workers' rights, safe work environments, proper, non-expired personal protective equipment, and improving laws that support working people. We've certainly been adapting to work life during a pandemic, and I'm excited to listen and learn from our guest speaker, Ela Partyka. Ela Partyka is a master's prepared social worker and an MBA candidate with nearly 20 years of experience in mental health and leadership management. She's passionate about supporting organizations to create a safe and healthy work environment, to protect and promote employee mental health, and deliver the best business and people outcomes. She's the program director of the Canadian Mental Health Association for Manitoba out of Winnipeg. And I want to thank Ela for giving us your time and sharing your knowledge and experience. The screen is yours.
Thank you for this wonderful welcome, and welcome everybody. I hope you're having a good day and a good evening. So I'm just going to share my screen here with you. And Andrew, you can let me know if that's all good to go. It looks good on my end. Can you see this?
It looks great, Ela.
Awesome, thank you. Okay, so we're just going to jump into it because there's a lot of information that I want to share with you. I really want to have an opportunity to answer all of your questions tonight. You have my contact information here. If you also want the slides or any information after, feel free to email me or ask Andrew or Kevin for the information, and that's cool with me. Okay, so let's talk about mental health, work, resilience, pandemic, and see what we can find out and what we can learn together to protect and promote our mental health during this unprecedented time. So first of all, I want to sort of set us on a foundation about what mental health is. And sometimes people use mental health and mental illness terms interchangeably. And in fact, they're very different. Mental illness is under the umbrella of mental health continuum, as you will learn in a minute. But mental health is defined by Public Health Agency of Canada as our capacity to think, feel, and act in ways that enhance our ability to enjoy life, deal with challenges we face. It is a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. So you can see that mental health is really sort of complex and it's difficult to perhaps articulate, but basically it is feeling good about who you are and your circumstances, and it having a good impact on your ability to engage with the world. Whoops, I'm pressing the wrong button. One of the most important things that I want you to take away from today is understanding that mental health is a continuum. It's not simply an absence of an illness. So what that means is that we all experience fluctuations in mental health any given day, week, month, or a year. It's very easy to move back and forth, and we'll talk about it in a minute. What does it mean to be at the healthy end of the continuum? It means that we experience normal fluctuations in the mood. It doesn't mean that you're optimistic and happy all the time, because the circumstances may call for other emotions. So some circumstances call for sadness or anger even. So having those fluctuations is very normal and natural and appropriate. So normal fluctuations in mood, normal sleep patterns and ability to get rest and feel refreshed when you get up, and feeling physically well, which really enables us to perform well at work, and also engaged in the responsibilities you may have in our lives, and be socially active as well. So what moves us into the reactive state? It could be any circumstances: being stuck in traffic when you're late for an important appointment, having an argument with a loved one, having tensions and pressures at work. Normal sort of challenges and circumstances in our lives can quickly move us into the reacting stage of mental health continuum. And this is where we start feeling uncomfortable and challenging emotions that are sort of lingering, are not as passing as when we're in a healthy state. We may feel irritable and more intense sadness or prolonged sadness. We may start experiencing challenges with sleep. We may feel physiologically changes in our body, so tension or pain and headaches, upset stomach, low energy, fatigue. And all of these signs and symptoms contribute then to our inability to perform at the same level as we normally would. So we may procrastinate, we may withdraw from social activities, and so on and so forth. When life circumstances sort of present more serious challenges like job loss or relationship breakdown, or health crisis, mental health or physical health crisis, or a pandemic, for example, we may find ourselves in a mentally injured state. And that really means that you're experiencing the emotions at a higher to a higher degree, higher intensity, and for a prolonged period of time, and they impact your daily activities in daily life in a more significant way. So, you know, when you're injured, you are, think about it as, you know, when you break your leg, let's say, you're not functioning at the same level. And so with mental health injury, you would not be able to function at the same level. So then when we become ill, we may, mentally ill, you may experience the severity and length of symptoms for a prolonged period of time, to the point that it meets the criteria for a mental illness diagnosis, whether it's depression, anxiety, post-traumatic stress disorder, schizophrenia, or other illnesses. The beauty about mental health is that wherever you find yourself in a continuum, you are not likely to stay there forever. There is an opportunity for you to take action and engage in activities that would move you closer to the healthy part of the spectrum, end of the spectrum. So that's really important to know that if when you become injured or even ill, there's opportunities to recover, and there's opportunities to experience well-being again. So, you know, I usually encourage my audience to, you know, have this continuum readily available somewhere board or reminder board somewhere to remind yourself when you're feeling certain, like a state of mental deterioration, to sort of check with yourself where you are at and take action, appropriate action in order to help yourself. So you can see at the bottom here, it talks about the actions that you can take at each stage. And in the injured state, it says that it encourages people to seek social supports, and even, I would say, professionals seek help. So to complicate this even further, we're gonna add another dimension to this continuum. And this dimension really takes takes resilience into account. So resilience enables us to experience well-being regardless whether we have diagnosis of mental illness or not. The example that I like to use in terms of to understand this concept is that individuals, for example, with physical illness diagnosis, like diabetes, for example, having the diagnosis of diabetes doesn't preclude them from experiencing well-being and flourishing, or being an active participant in the world and at work, right? And the reason why some individuals with the diagnosis of diabetes or other physical illness can experience well-being is because they understand their illness, they have a care plan and treatment plan, they have a treatment team, they have social supports, and they've learned coping mechanisms to help themselves flourish despite having a diagnosis. The same is true with mental illness. Just because you're experiencing diagnosis or living with diagnosis of depression or anxiety or even schizophrenia, it is possible for people to be flourishing and experiencing optimal mental well-being by virtue of understanding their diagnosis, understanding how to maintain their well-being. They have a care plan, treatment team, social supports, and have learned various coping mechanisms to really protect their mental health and promote their well-being. So the opposite is true. If you don't have a mental illness diagnosis, that doesn't mean you're going to be flourishing. That doesn't mean that you're going to experience optimal mental well-being, because if you lack social supports, if you lack self-awareness, if you engage in unproductive coping mechanisms, if you're withdrawn socially, you may in fact experience minimal mental well-being or languishing, that we like to call in mental health field, despite the fact that you may not meet the criteria for mental illness. So just like we move back and forth on the continuum, mental health continuum, we can move all around this this diagram as well, depending on any particular time of year or day or anything like that. It's depending on our circumstances and our ability to manage the situation. So we know that we all have mental health. We all have mental health, and just like we all have physical health. We also, oops, excuse me. Oh, sorry, technical challenge. There we go. We also know that 1 in 5 Canadians will experience mental health problems any given year. And we also know that by age 40, which is quite young, 50% of the population will have or have had mental illness. Those statistics are staggering and may be surprising to some of you, but mental illness is more prevalent in the world than other physical illnesses. So it's very important that we talk about mental health, and we talk about mental illness, and we talk about resilience to know how to protect and promote our well-being. We also know that COVID has exacerbated existing mental health challenges that people experience, and also brought on new signs and symptoms of mental health problems. So along that continuum. So a lot of people are experiencing symptoms of reactivity or injury due to COVID. And so at the onset of COVID, the statistics showed that 38% of individuals experienced decline in their mental health. Nearly 50% felt anxious and worried for various reasons, right? About their own health of others, job security, exposure if you're a frontline employee, and so on and so forth, and experiencing difficulty coping. And it makes sense, since if we have closures, a lot of our coping mechanisms are stripped away. For example, if going to the gym has been a coping mechanism for you, gyms are closed, right? You need to be flexible and adaptable to find alternate ways of getting, of coping. The same is true with socialization and having contact with people, going out to movies or dinner or other recreational activities. So I think those statistics make sense. And we also have learned that 10% of Canadians are experiencing thoughts of suicide. And those are very high numbers that we need to be aware of and concerned about, and talk about those things and learn as much as possible in order to help ourselves and help others. I wanted to say something about that, but the thought totally escaped me. I will come back to it when I remember. So today, actually, I received another research study results that was conducted by CMHA and University of British Columbia that demonstrated that those numbers are just increasing because of the second wave, and because of the length of time that we have been experiencing this situation. So 71% of Canadians indicate being worried, right? And we see such high numbers of infection and also death that it does make sense why people are concerned, and also are concerned about how long is this going to take, and what's the impact on our lives and our well-being and our kids and our work will be. The study also showed that 40% of Canadians say that their mental health has deteriorated, and those numbers are higher with people who are unemployed, higher with individuals who have had pre-existing mental health issues, with young people, which is very concerning and very important for us to remember. If you have kids, adolescents and young adults, these young people are really struggling. When you think about it, their social peer groups are primary source of support and very important in that stage of their life. And that's being taken away right now. Physical activity and belonging to clubs and recreational groups. So that population is really feeling the impact of this. Same with Indigenous people and LGBTQ and people with disability. So, you know, I know what I was going to say. So in mental health, we actually, you know, we know that COVID pandemic is very serious. What we are concerned about is mental health pandemic and people struggling so much and committing suicide. The study also, I think I saw a letter today, another study that demonstrated that crisis lines, suicide prevention crisis line, have experienced 200% increase in calls. So that's tremendous. And I'm so glad that people are calling for help, but also concerned about the amount of people that are finding themselves so desperate and unwell. So why do we talk about mental health in a workplace? You know, traditionally people thought that mental health is a very private thing. And there's still stigma about mental health and mental illness, and people don't talk about it very much. People are more willing to talk about their physical ailments. So I'm sure you yourself or you've heard colleagues come to work and say, oh, I have a headache, or my head is pounding, but not many come to work and say, my gosh, I had a fight with my teenager and I'm just so worried about A, B, or C, right? And so that's a sign of sort of not accepting the fact that mental health, just like physical health, comes with us wherever we go, whether we're in personal life or at work. Additionally, because we spend so much time at work and we spend over 60% of our waking time at work, it's naive to think that work environment will not impact your well-being. The sort of work that you do, the pressures and stress and deadlines that you're experiencing at work, the relationships that you have at work with your colleagues and your superiors, all impact the culture of the organization, all impact our well-being and health, right? Just like our life circumstances and just our personal skills. So it's very important for employers and organizations to pay attention to what sort of work environments they create. Why this is important also from business perspective is that mental health problems and mental illness costs our industries and our economy thousands and billions of dollars, in fact, $52 billion a year. These are some of the statistics that 500,000, 500,000 Canadians don't come to work any given week because of mental health problems. So, people call in sick because they're in a reactive or injured state, right? We also know that even if people attend work and they're not absent, they may be not as productive, and we call that presenteeism, and that costs a lot of money too, right? We also know that workplace disability claims related to mental illness are 1 in 3, and also they cost 3 times more than physical claims due to physical injuries and illness. So it's very critical that not only do we think about mental health in our personal lives and in our families and communities, but also in the workplace to protect our own health and also promote productivity and engagement and joy and happiness of the work that we do. So some of the signs and symptoms, the functional signs and symptoms of mental health problems in the workplace are very self-explanatory. When we're thriving and we're in the green, we are very productive, we're eager to engage in new initiatives, we are punctual and come to work, we engage in socially with our colleagues, we find meaning and joy in a workplace, hopefully. When we're in the reactive or injured state, our performance, engagement, and ability to take on work is diminished, right? We may be less social, we may be more moody. That may impact our ability to communicate effectively with each other, and problem solve and conflict resolution suffers. Safety is an issue as well. We know that people who struggle with mental health in a workplace make more errors, are more likely to get into accidents. Because their focus is not there, right? And they may be fatigued, they may be preoccupied. And so mental health problems in a workplace are manyfold, and it's very important that we pay attention to that. We also know that when colleagues are absent, that means that you have to do more work, which then impacts on our own health and ability to engage in work, right? So it's very important that we really take care of each other and make sure that we are supportive to one another. Obviously, when things are further deteriorated and someone has mental illness and is not flourishing, right? So when you remember that that diagram, their ability to function in a workplace declines even further to lack of ability to be in a workplace. And you may see all these sort of symptoms get exacerbated to the point of not being able to function and perform at all. Okay, just want to check this. Okay, good question. So there's a question. Do you know of any models for return to work following a mental health leave? I know it exists for physical injuries. Yes, and they say, oops, sorry, I'm gonna go back. I think it depends on the injury. I think there's a number of things that, first of all, I think prevention is critical. So organizations have to really take a proactive approach in protecting workers from psychological injuries, right? And so that means number of things. But in terms of return to work, depends on the injury. We know that psychological injuries can take longer to recover. People can take longer to recover. But we also know that the longer you stay off work, the harder it is to return. So it's a fine balance that really needs to take into account the sort of work a person does and the risks associated with them being, let's say, present when they are not fully recovered. So I'll give you an example. Someone who's let's say a paramedic or a police officer or frontline responders, emergency responder, when they're suffering, let's say, with post-traumatic stress disorder, I would not recommend them returning to work unless they're fully recovered. Because going in with even being in a sort of injured or higher level of reactivity may put them and others at risk, right? Because our ability to cope and manage stressors is very different. If you work in a sort of office environment where you know the circumstances are such that they're not calling for high-risk situations and where life and death is not a variable, where those risks are almost nil, that may be a different conversation. So it really depends on the type of injury someone experienced and the type of job that they would be returning to, that I would recommend the approach be different. So really case by case basis, it's very difficult to have a sort of a universal or a formula to the process. I hope that answers your question in a roundabout way. So we know that mental health challenges impact our ability to be productive at work and how we operate at work. And we also know that COVID has exacerbated, or complicated further our ability to function well at work, whether you're working from home or whether you are working front lines. You may be experiencing signs and symptoms of mental health challenges in a reactive or injured state, and we'll talk about why that is in a minute. But I encourage employers to think about COVID, like some organizations like to continue normal routines, and I think to some degree that's nice to try to do that. However, I would caution everybody, because to think that this is business as usual is not helpful or productive for anyone. It could put people at further risk and diminish their productivity even further. It's not business as usual, and we need to make adjustments and adaptations to help individuals manage themselves and do the work that they have to do. So because people will experience difficulty concentrating, and this is a study that revealed that 30%, almost 30%, and I'm sure these statistics again are at the onset of COVID, so they're much higher, I'm sure, at this point. People are struggling with being productive at work, and I'm sure that's true even further for people who are frontline employees and might be experiencing signs of burnout. So what is the organizational response? What could be the organizational response to workplace mental health concerns is the National Standard of Psychological Health and Safety. This standard was the first in the world, and it's a national Canadian standard that came up in 2013. It's a standard that talks about 13 factors that contribute to health and safety of employees from the psychological health and safety perspective. And I'm not going to go into details about this. I do have other workshops and presentations that address this, but I know that a lot of individuals don't know about the standard still. The standard is still voluntary. It's not legislated. I know that there's some components that may be legislated, like harassment and bullying. But all these components and variables contribute to creating psychologically healthy workplaces that contribute to health and safety of employees at all levels. So let's talk about COVID fatigue. I'm just going to be mindful of time here. And we use that phrase, and I just wanted to let you know that COVID fatigue is a real thing, and I'll explain to you why. So this is a curve that represents sort of how we experience stress and the impact stress has on human beings, okay? So stress in itself can be anything that stimulates us, right? It could be noise, it could be things that we have to do. When we don't have any stress or stimulation, we can experience boredom, right? So stimulation is a good thing. It motivates us, it engages us, it energizes us. And then when we're in that happy state of stress, so there's enough stimulation and enough things going on to do that, we feel energized and focused, and we work well and almost feels effortless, right? And so this applies to athletes, this applies to any human beings, really. Each one of us will have perhaps a slightly different optimal performance, peak performance, right? Some of us can withstand more stress for longer, some less. But the bottom line is that when we tip the scale and when we experience a prolonged stress or high levels of stress, we move from what's called eustress to distress. And this is where we start feeling fatigue and all these, we're becoming reactive, right? fatigue and irritable and just off, and experiencing what I like to call mental health cold, right? Just not yourself. And as stress continues or increases in intensity, those symptoms get exacerbated to exhaustion, ill health for physically and mentally, breakdown and burnout. And so it's not, COVID fatigue is not a imagined thing. It's a real thing because of the stress that we experience due to the pandemic. So all of us are experiencing some level of COVID fatigue. I actually have not met anyone who doesn't experience some signs and symptoms of COVID fatigue at this point. And depending on the work environment and your life circumstances and so on, and your personal skills, you may experience it to greater or lesser degree. So this is why it's important for us to build on and develop resilience. And I like to call resilience the mental health immune system. So in order to keep our physical immune system strong and healthy, we're encouraged to eat healthy, exercise, get enough rest, right? All these kind of wonderful things. The same is true. There's some things that we can do to build and strengthen our resilience. And we can teach this to our children as well. Because resiliency helps us cope and adapt and recover in face of adversity, right? Adversity is a natural part of life. Failures, big and small, even like getting an F on or a reduced grade on a test can feel like failure, and resilience helps us cope with that. Various trauma, tragedy, threats, harassment, loss, relationship problems, financial problems, health problems, work issues. I mean, the list is long, right? So it's really important that we have the skills and tools and the resilience to manage them and remain as close and as long in a healthy part of the continuum as much as possible, and into the flourishing as much as possible. So being resilient does not mean that we avoid stress. It means that we can adapt and face and recover more effectively from stressful situations and adversities. In fact, what resilience does, it really shifts the bell curve and allows us to withstand stress for a longer period of time and greater intensity, which has become more resilient. It's like we build on strength and ability to manage it for longer and better. So it's critical that we develop the resiliency, and it allows us to move from surviving to thriving. Right? When we are surviving, we are really functioning at a sort of low end, I'm going to say sort of primitive level, I would say. What I mean by that, we're more likely to be sort of hijacked by our primitive brain, right? And we get reactive and act out of fight-flight response rather than from our frontal cortex and logical sort of approaches and ability to, focus and analyze and plan. So surviving, you may experience, when you're surviving, you're living with a lot of physiological and emotional signs and symptoms of stress. You engage in unhealthy, coping mechanisms, even addictions are signs of surviving, in fact. Sense of isolation and unhealthy relationships, and sort of doing the same thing over and over again without seeing positive results. So it's very important that we develop and encourage people to build resilience in order to, like I said, be able to be aware of our own sense of well-being, know the tools and resources, both internal and external resources, to help ourselves and respond to situations in a more healthy and appropriate manner to keep us in a thriving and a healthy state. Okay. So, what do we do to build and strengthen our resilience? We really have to address resilience from all the four different four dimensions. So we know that mental health and physical health are really interconnected, right? So on a physical level, it's very important that we strengthen our fitness and stamina, and we engage in healthy, balanced nutritional intake for energy, and we rest and allow ourselves to recover. That really promotes resilience. From an emotional stance, when we are resilient, we are more likely to be calm and focused. We are more likely to control our impulses and less likely to be reactive and more likely to be responding. We have a better ability to regulate our emotions, so we still would experience variations in emotions, but they would be more sort of fluid rather than very abrupt and frequent. And we experience sort of realistic optimism, right? So again, it's not this Pollyanna pink colored glasses optimism, but just a realistic positive outlook on ourselves and on life. And so then from mental perspective, when we're resilient, we have a good outlook and perspective on life. We believe in ourselves and have a sense of self-worth and efficacy. We avoid sort of, or know how to manage any thinking traps, like a black and white thinking, all or nothing kind of thinking. We can sustain focus and engage in causal analysis, and we know what's in our control and what's not, and are able to relinquish control with things that we have no control over. And then, of course, spirituality is also important, and this is distinguished from being religious, although being religious also falls under the umbrella of spirituality. We all engage in different ways to create sort of sense of connection and meaning, and it could be through connections with humans, with animals, through music and art and various activities, including prayer and attending any sort of religious ceremonies. So it's important that we address all these components, including external resources that would help us build resilience. So what I like to encourage people when we are experiencing de-stress, or we're like tipping over on the stress scale there, or the bell curve, or when we're in the reactive and moving into the injured state, from a physical perspective, I always say the higher the stress, or the longer you experience the stress, the more likely and deliberately you have to engage in basics. So what I mean by that is eat, sleep, and exercise. So eating balanced, eating as healthy as you possibly can, getting enough rest, so you are able to sort of face the day again the next day, and keeping your body healthy by moving it and keeping it strong. So from the mental and emotional perspective, it's very important that we learn about mental health, like we're doing today, and really being able to become self-aware and mindful of what we're experiencing and where we are at, what triggers us to move into the reactive, what our responses are when we are stressed out, and then also knowing what works for us when we are in those stages of mental health continuum. So practicing mindfulness really allows us to become mindful of our internal responses and how the stimuli of stress can impact us. And exercises like relaxation can really help us maintain that emotional balance and also emotional balance and sorry, I'm losing a word again, so that's going to come to me. And it's very important that we also practice self-compassion, because we all make errors. We're all, are not at our best all the time. And so it's very important that we are able to be kind to ourselves and forgive ourselves for making mistakes and moving on, learning from them and moving on. And so then from social and spiritual perspective, it's very important that we stay connected. And this is very challenging during a time of such restrictions as we are experiencing these days. We are social beings, and we require, for our well-being, require not only contact with other human beings, but also touch with other human beings. We know that babies can't and don't develop appropriately and well when they're not being touched. And that doesn't stop when we get older and become adults and elderly. We still have that need as a human being. So during this time, it's very important that we remember that. And if you are lucky to have loved ones in your life, and you can hug them and hold them and laugh together and talk together and be together, that's wonderful. But there's a lot of people out there who are single, who live alone, that may not have opportunities to do that. That's why I think a lot of pets can be very therapeutic. Cats and dogs and other creatures can be very therapeutic to help people with that. But it does, it helps, but I don't think it replaces human connection. So despite the fact that we have to physically distance, I think it's very important that we find creative ways to connect with others, both in a workplace and at home and with our families and communities. It's also very important to know who your supports are and to know which friends to call for what issue, right? So we have friends that we can call for a good laugh. We have friends that we can call for, deep, intimate conversation. We have friends that we can call when we have to move furniture or something like that. So it's very important to know who can be helpful to us in what way, and vice versa. And then also cultivating and creating understanding and compassion in those connections. Understanding that everybody in your family, everybody in your circle, everybody in your work is experiencing all of that. It's so, we're all sort of on the reactive state, and we need to be a little bit more compassionate with one another in terms of understanding our ability to manage things. So it's important that we talk about mental health with each other and at your dinner table with your friends and colleagues to really support one another around that. And then, of course, last but definitely not least, is understanding what supports, community supports and external supports are there for you. Knowing who your EAP provider is and how to access them. And I want to also tell you about the various CMHA programs that we have to offer here in the province that is accessible to anyone in the community, regardless your age and circumstances. So CMHA offers services along the mental health continuum. So whether you're healthy, injured, ill, we have something for you. Service Navigation Hub is the first point of contact to CMHA. We're the 411 of mental health. We have connections with various mental health agencies and services, and we have clinicians that answer the calls to be able to assess the situation that the caller has or is experiencing, and knowing how to help them navigate the system and get the support that they require at the right time. And so you can call us at this number, or if you are from outside of the city and you don't have a long distance plan, you can email us. Hopefully there's internet. And we are willing and able to help you out. We work Monday to Friday. We're not a crisis service, although we do receive crisis calls and we are equipped to deal with them. But regardless of how simple or challenging the situation is, we are able to help you and guide you to the right resources and to help you recover or keep your mental health strong and healthy. The next program that I want to tell you about is called Bounce Back. And this is a cognitive behavior therapy based approach. It's an over-the-phone coaching for individuals who are experiencing mild to moderate depression. We have a stream that's dedicated to youth, so 15 and older, and for adults. And we're working on one that is culturally sensitive to Indigenous culture as well. And so this is a free service, and when you call, you will be assessed, you will be linked with a coach, and you will be provided various resources that you will work through with your coach to strengthen your resilience and help you manage your signs and symptoms of anxiety and depression. Wellbeing Learning Center is another wonderful resource that offers various educational opportunities throughout the year. Again, on this continuum, we now have pivoted fully into remote learning. So we offer all of the training opportunities virtually like this. If you go to the website, and most of them, almost all of them are free of charge and available to anyone. You will just go to the website and you will see a calendar and a list of different offerings, and you can register and learn together and meet other people as well who are on the recovery or a journey. The other resources that we have that I want to tell you about that that may be helpful to you is, first of all, if you find this response to COVID on our website, under that we have a variety of articles that we have collected and written about how to manage and cope with COVID during this time, and how to help others like our children and loved ones to manage. And then also we have a document that's more specific to a workplace, and it says return to workplace, but really it means working during COVID. Whether you are working from home or in the on-site or front lines, wherever you are, it really provides you with the psychological toolkit to manage. And it's very much along the same lines as our conversation today, to understand why you may be struggling and how to address those issues, how to talk to your employer as well. There's a part in there about that, and links to resources. So I encourage you to, it's a PDF, so you can print it and have access to that for free as well. And then, of course, because there's such increase in suicidal attempts and suicidal thoughts, we have a program through partnership with Living Works. And they're an organization that creates and provides services around suicide prevention. It's a 90-minute online training course for anybody, a general public, that coaches you and teaches you how to have life-saving conversations. And it's sort of self-directed in that you can take your time in going through the training. If you go through it sort of continuously, it only takes 90 minutes, and it really leaves you more empowered to have those conversations that can possibly save life. And this program, there is a slight cost associated with it. I think it's about $25. So it's quite inexpensive for an amazing service. And last but not least, we also have another online training that's brand new to CMHA, and we have created, actually CMHA Manitoba and Winnipeg has created this Wellbeing Central, which is a virtual recovery college. And we're gonna have, eventually the vision is to have a variety of different training opportunities there. Right now we have one course that's called Wellbeing course, and it's self-directed web-based that really looks at how do you maintain your well-being, strengthen your well-being through creating all these different habits and behaviors that build and strengthen resilience. And this is interactive, free, and you can do it at your own pace. You just have to register and start on the journey. So this is the end of my presentation. I hope you found this helpful, and I'm more than happy to answer all of your questions.
Great. Well, thank you, Ella. That was wonderful. And we do have a couple of questions that have popped
Perfect.
up. So the first one that's being asked is, for licensed healthcare providers like nurses, doctors, health aides, mental health issues are a stigma. Their respective colleagues make it difficult for healthcare providers to return back to their practice. Healthcare providers have to declare any mental health issues upon renewal of their license. The colleges are not usually understanding or sympathetic to their members. As a member of a healthcare association, what's your take on this? And do you have any plans of action, or I guess advice, for regulated professional bodies to be more understanding of mental health issues that healthcare providers are experiencing in their line of work?
Yes, thank you. That's a really good question and a very concerning comment. I think actually having worked in healthcare for many, many years and being a clinician myself, I can understand that healthcare providers, are in a line of work that really predisposes them to higher levels of stress and potential for injury, mental health injuries. We know that frontline responders experience, I think it's about 40% higher chance of being psychologically injured. And yes, stigma is tremendous in those areas, and CMHA works diligently in addressing those issues. I think that there's lots of opportunities through psychological health and safety to educate employers and professional groups around the importance of psychological health and safety, and to stop stigmatizing their members and employees, because stigma just prolongs the recovery process. It prolongs or it discourages people from seeking support earlier, and that prolongs their illness and possibly leaves them in an ill state where they're never able to return to work. I think if I would encourage everybody to become a champion in mental health and psychological health and safety, and start talking about it, perhaps printing the standard and leaving it on the leader's desk and saying, hey, have you heard about it? Or saying, hey, I've heard about CMHA, and them doing all sorts of presentations about psychological health and safety. How about we do something like that? Can be less threatening. But it's a complex systemic issue, and I think that there's no fast and easy answers. We simply need to work together and talk about it, and hopefully create enough momentum and movement forward that we can change the system. I hope that answers your question. Again, there's no simple answer. Yeah.
think all of these things need work and cooperation and clear communication. So that
Absolutely.
psychological standard and sharing it with those who are in positions to implement it would be a really powerful step. I do see in the chat a number of people are asking for copies of the slides, so we'll arrange
I
for
can
that
do that.
tomorrow, that we can get that email to everyone. So I see people kind of individually asking. We will get it out to all of you. We'll do that tomorrow for folks. And then another question that's come up, and maybe I'll start an answer for it, and I'll ask you to carry it on. But they're asking, are the resources open to family members too? And I believe Ella's giving us community resources that are open to everyone. We also have a resource who I see is on the call as well, and Gina McKay is on the call as a participant, but a part of her role with United Way and where she comes from is to help union members or workers who might be struggling to find out what community resources are out there to help them in challenging times, whether that's during a pandemic or not during a pandemic. So she's an internal resource we have in our own labor movement that people can call and reach out to, and she can help make referrals. But perhaps you could speak a bit more to the resources you were highlighting today and how people can best access them, or are there costs involved, those kinds of things.
Right. Thank you, Kevin. Yes, all resources are available to whoever you are, all family members. The best way to access CMHA resources is through Service Navigation Hub. So you would call and say, oh, okay, so this is what I'm looking for. How do I register for this or for that? You can go on the website, they can walk you through it, whatever you need. We have specific resources for youth as well, and for adults. We don't really treat kids like under 15, but we can certainly find resources and point you in the right direction. We do that all the time, and we have good relationships with various organizations and mental health institutions to help people access services. So yes, absolutely is available to anyone. We actually, even in Service Navigation Hub, we get calls from employers, from colleagues, from clinicians. We get calls from social workers all the time, from family doctors saying, I have so-and-so in my office, I don't know where to send them. And so regardless of who you are, no question is a stupid question. No issue is a stupid issue. Just call Service Navigation Hub and we'll help you figure it out. So yeah, so it's available to everybody.
Great, thank you. And I realized as I spoke about Gina, I didn't say where she was from, but she did in the chat. So she is the labor director at United Way. She shared her email there, or you can call the United Way line too to reach her as well.
And United Way, we are a United Way organization. So thank you, United Way. And I love working with you guys and providing awesome services to our Winnipeg and Manitoba colleagues and society and communities.
You're here. So we do have the line open for more questions. Maybe just on that note as well, having some familiarity with those programs and supports. You know, as union members, often we have, not always, but often many of us have EAP programs at work that we're able to access as well. I recognize some folks sometimes are a bit mistrustful of those. I wish that weren't the case, but often that's because it's rooted somewhere that has created that. So the community resources that Ella is highlighting, or that Gina can help connect you with, or additional ones that aren't tied to your workplace in any way, shape, or form. Sometimes there are some costs involved, but often there are many free community resources, particularly around mental health issues. So they can help make those connections.
And we also, under Workplace Mental Health Solutions at CMHA, we offer various services and presentations to organizations. So if your organization or you know, some other organization that you know wants to engage in learning about mental health and psychological health and safety, we're happy to do that. I'll include that in the email with all the resources. I'll send that to you, Kevin, and I'm happy to support individuals, families, and organizations and communities the best way that we can to get through this and beyond.
That's great. Thank you. Does anyone else have any other questions? You've answered all the ones in the queue at the moment.
That's awesome. Yeah, and if people, you know, have some more personal sort of questions, they can definitely call me or email me. I'm happy to support and assist in any way I can.
That's wonderful. Well, we will share your contact info. Oh, we've got another one in the chat, I think. How are you finding wait times have been since the pandemic started? Oh, that's a good question.
It's an
Sometimes when people
excellent
reach out to
question.
community organizations because they don't have a cost associated with them, sometimes there is a wait. Can you speak a little bit to that?
Absolutely. And unfortunately, there's lots of barriers to access because of the pandemic. But I also know that a lot of services have pivoted to offer services remotely. So actually recently this week, I called a crisis response center for a participant that called my line. And they were able to connect, I was able to connect them with mobile crisis line that does their services remotely during COVID. I also spoke to a colleague who works in general intake in mental health psychiatry for adults. And he said that their numbers and calls for help have increased 200%. So I think there is wait list. The beauty about CMHA is when you call Service Navigation Hub, for example, and we assess you that you need, let's say, to see a psychiatrist, we will help you find a psychiatrist. And while you're waiting, we will continue to support you. So we really work hard at helping people in the meantime, the best that we can. We wouldn't necessarily be able to provide you the same set of service, although, and I just wanna clarify that psychiatrists are really good at prescribing medications that are not always doing therapy and counseling, but there's other resources and community services that do. And so we do at CMHA know all those community resources, and we can help people access them. And there I see another note, Manitoba 211 is now offering phone and online support for live connections to mental health and social support resources needed in 150 languages. This is wonderful. I didn't even know about this, so I will definitely share it. And one of the resources is CMHA, yes. So actually, the Manitoba, like the yellow pages, right? Every year we need to update our yellow pages with Manitoba 211. So they would have a list of resources, and I'm very happy to hear that they're offering the service and really helping people connect with the right services. That's excellent. That's really good to know. And again, it's important to know that wherever you are in the province, you can call Service Navigation Hub or email us if you don't have long-term, long distance plans, and we will help you find services in your area or remote services to help you during this time.
Thank you for that. Yeah, I think, I mean, particularly, and thank you for everyone who's on the call right now. You know, many of you are on the call because you're union activists above and beyond the work that you do, and whether that's working in an essential service job or elsewhere or providing support to people, it's a challenging time for everyone. And I think Ela's presentation really talks about the importance of connections, about talking with people, about having a network and a support system and not being shy to reach out and make those connections and communications with one another. If you're in need of professional help, we can help make those professional connections as well. You know, I think there's a lot of interest in our mental health,
Yeah.
and figuring out how to keep healthy in these challenging times. Ella?
Yeah, one more thing that I actually learned today. I saw an announcement that Blue Cross actually will be offering free bereavement counseling for people who lost a loved one to COVID. And so that's amazing, right? So just so you know, if you know someone who's bereaved due to COVID, there are free resources there. And I also know that Palliative Manitoba offers bereavement counseling as well. That's free of charge. So those services are also very important at this time.
Yeah, very much so.
Mm-hmm.
Great. Well, I think we've answered the questions to date. There
Perfect.
may be some that follow, but I want to thank you so much on behalf of
My
the
pleasure.
Federation of Labor for giving your time and knowledge and experience, and we'll share those slides with folks. And thank you all for joining us. Hope you have a wonderful evening. Stay safe, stay connected.
Yes, thank you, and happy holidays. I know holidays will be perhaps different, but happy New Year to you all, and hopefully next year is better. So take care and stay healthy.
Take care.
Thank you. Bye-bye.